Good afternoon. It is Wednesday, March 25th, 2020, and this is your Plymouth COVID-19 update. We're coming to you live from PACTV, and it is about 12 noon. I'd like to welcome all of you today to this presentation. I am Steve Triffletti, and I am Plymouth Town Moderator. Today we have a great group of participants. As always, Kenneth Tavares, who's the chair of the Plymouth Board of Selectmen, and Representative Matthew Muratore, who is our state representative. In addition, we're joined today by Dr. Kenneth Terkelson. He is a member of the Plymouth Board of Health. Michael Botieri, who is the Plymouth Police Chief. Amy Naples, the Executive Director of the Plymouth Area Chamber of Commerce. And at this time, we're going to go directly to Ken Tavares, the Chair of the Plymouth Board of Selectmen, and he's going to provide us with the opening from the town update. Ken, welcome.
Thank you, Steve. Good afternoon, everyone. I have a statement from the town clerk that I would like to read to you. It's involving nomination papers. On Friday, March 27th at 5 p.m., the deadline for the town clerk's Board of Voting Registrars to receive nomination papers for the May 16th election is coming about. In the midst of this disruption, the town clerk wants us to recommend the following. For those who have nomination papers to submit, you can deliver them by mail. The postmark will be proof that you have submitted on time. Mr. Pizer recommends that you scan them. A cell phone photo will work, and send them to lpizer@townhall.plymouth.ma.us. You may also deliver them to the Town Hall drop box. As many of you know, the drop box is to the left of the door of the main entrance. Mark on an envelope the time that you delivered them. For those of you that still want to take out nomination papers, you can email them to Mr. Pizer and scan them into him. He's recommending that. If you have any questions, Mr. Pizer is continually accessing his voicemail. The number is 508-322-3302. I'll repeat that, 508-322-3302. There'll be no exceptions. The nomination papers must be in by Friday. So we consider this forewarning. Also, there have been quite a couple of questions that are coming up in the last couple of days. One is the use of plastic bags. We anticipate having a statement on that, hopefully by the end of the day or tomorrow. Also, golf courses have been calling, and Matt has informed us that golf courses for maintenance fall under the same category as landscapers, so that if you have a golf course, you can continue to maintain it with your workers. But the most important part is you cannot be open to the public. That is absolutely forbidden. And the last thing that I'd like to tell you about what we're working on is the homeless. We have a population that varies anywhere from 15 to 30. And there are a number of discussions today, since most of the shelters are closing the 1st of April. We're looking at ways to take care of this population. Thank you.
Thank you. That was Kenneth Tavares. He is chair of the Plymouth Board of Selectmen. We've been providing these updates daily, and we've been getting a great response. In fact, some of the questions that are being answered are as a result of people who have watched us. I actually got contacted yesterday on the issue of the nomination papers, and I referred it to Lawrence Pizer, our town clerk, and you heard the answer today from Selectman Chair Kenneth Tavares. We have been doing this every day of the week. Beginning this Sunday, however, we're going to be doing 6 days a week, so we will not be having a cable cast on Sunday. Many of our seniors have been watching daily. One of them was communicated to me that she finds it very soothing to be watching this on a daily basis. So I'm going to give a little shout out to Roberta if you're watching today. For people that want to send questions while we're having the cable cast, you can do that by emailing plymouth.info@pactv.org. And at this time, we're going to go to our next guest. It is Dr. Kenneth Terkelson. He is a member of the Board of Health. They just had their meeting today. He also is going to talk a little bit about where he works and what they're doing in response to COVID-19. Welcome, Dr. Ken.
Thank you very much. The first thing I want to say in regards to the board is we did meet this morning, and two issues that I want to highlight out of several issues that were discussed and resolved at the Board of Health has to do with capacity development relating to the ability of our existing public health nursing capability to manage tracking and contact tracing, and also some about public education in regards to the need for social distancing. The two things that came up is first that there was a resolution that was passed by the board asking the select board to seriously undertake the consideration of having a full-time public health nurse. I think historically, my understanding is there was a public health nurse some years ago, but as typically happens, if there isn't an obvious and immediate need, that funding goes off, and Ken Tavares may be able to speak more to the history of that. But anyway, I think that now it's pretty clear that we do need to have a full-time public health nurse on board, and we're asking the select board to take that up very soon. The other related to that is that Carolyn Rains, who is in the school system, because of the fact that the schools are not in session right now, has been assigned, I believe, to the Department of Public Health, and will serve in her capacity as a nurse to help out with staffing related to this particular epidemic. So those are the issues coming out of the Board of Health this morning that I think are most salient to our considerations this morning. The other is just a comment about what's going on in behavioral health. I should say that I am in practice down at the Community Health Center of Cape Cod. So I can't speak directly to what is happening here in Plymouth, but I can say that in all of our system, and I think largely throughout the state, most of the psychiatric services, and that also includes counseling services provided by licensed mental health clinicians, is converting over to remote telehealth and telephonic communication. And that is allowed under the governor's emergency order, and all of the insurance companies at this point have essentially say, we'll go ahead and pay for services over a telemedicine connection or even over telephone if it becomes necessary and can't be done any other way. The important thing there is that these services will be maintained and continued and will not be interrupted, or should not be interrupted as a result of this, so long as the staff remain in isolation themselves. That includes me. I'm sitting in my own home telemedicine studio at this moment, so that we will go ahead and continue to provide services. And I think that if you were to ask what's going on at Plymouth to any of the local providers, you would find out that the same thing has happened. I think that's a statewide conversion that took place last week. And I have other things perhaps we can talk about, but that's my main message today.
Thank you, Dr. Kenneth Terkelson. He is a member of the Plymouth Board of Health. Just as a follow-up to what he told you, just got an update from our local hospital here in Plymouth, and they are asking that you consider, if you have questions, to go directly to the CDC website, and it's very easy. It's cdc.gov. I just tried it. If you just type in cdc.gov, it'll lead you right to the website. The Beth Israel Hospital here in Plymouth also has an update. The hospital has extended the cancellation of all non-emergent elective surgeries, treatments, procedures, and tests through April 5th. That's through April 5th, and they will continue to assess the situation as it develops, and all patients have been contacted for all of these procedures through April 5th. They've been canceled. And at this time, we welcome our favorite police chief in the town of Plymouth, the one and only Michael Botieri. Welcome, Chief Botieri.
Thanks, Steve. Thanks for having me. I appreciate it. I think I'm the only police chief, so that's probably
That
why
may
I'm the
be,
favorite.
but-
But I want to start out by just letting the public know that we will and we have continued to respond immediately to 911 calls for service. Do not hesitate to call the police department if you have an emergency, a medical emergency, or anything like that. We're able and ready to respond to those. That being said, we have put some measures in place. I want to talk a little bit about what we've done at the police department at headquarters, the lobby, and some of the response changes we've made. So one of the main changes we made is that the lobby, we want people to avoid coming to the police lobby for obvious reasons. Less contact with the public is going to protect them as well as the officers. So unless you have an emergency. So if you do come to the lobby, you'll be greeted with a sign and a stop sign at the front door that will really just explain to you that should you have an appointment, you certainly can come in. There'll be appointments for investigations and different reasons for that. That's fine. And if you have an emergency, we want you to continue to come in. But if it's anything short of that, we ask you to go to the parking lot and call us from your cell phone, and we'll provide you with whatever service we can. With that being said, if you do have to enter and you find that you do have an appointment or an emergency you need to respond, we're asking that you use the sanitizer that we've set directly to your left as you walk in, hand sanitizer. So utilize that first. Come in, there's some coned off areas, and it'll keep you 6 feet away from people while we try to help you with your emergency. One of the other measures that we're put into place is that we're trying to handle a lot of calls over the phone. There are a lot of calls that can be handled over the phone. Past report of damage to something that's not in progress, some type of credit card or fraud issue, we can handle it over the phone and then further investigate later on. That'll limit the contact of us going to a house and having to interact with people. And once again, that makes it safer for the citizens as well. So those calls will be vetted through a supervisor, and we've assigned a couple officers per shift in the station just to handle those calls. Some of the other measures here at the station, so we were following the guidelines of DPH, the 6-foot rule, the distancing, the social distancing rule, and groups of more than 10. Obviously, some of our roll calls consist of upwards of 20 people. So what we've done is, when we need a roll call, we've suspended them unless there's a major need. Roll call is important to police. We pass on a lot of really good information that is time sensitive. So should we need to have a roll call, we'll do it in one of the garage bays, typically outside if the weather permits. So we have an open air area and everyone stays a good distance apart while that information is shared. We've limited access to the department by the officers as far as congregating, writing reports. They have a remote ability to do that from the cruisers with the mobile data terminals. And the issuing of equipment, we've made some changes there as well. So we've put a lot of measures in place in order to limit our contact with the public. So we'd ask the public to work with us on that. But I definitely want you to make sure that you call us should there be a serious emergency, and we'll be ready to respond. We have not been impacted at this point with staffing. Our staffing is as high as it's been. Our officers are at work. We're not having a lot of sick issues right now. Obviously, people aren't taking vacation, so we're staffed very well at this point, although we are ready should we end up losing several officers to either isolation, quarantine, or unfortunately, if they become sick themselves. We're working on plans to mitigate that by going to 12-hour shifts, possibly meeting with the unions later this week to kind of hammer out what would work for all of us. So we feel like we're being a little bit preemptive there. The officers are all armed with personal protection equipment, whether it's masks, sanitizer. I do want to kind of give a shout out to the Dirty Water Distillery here in Plymouth. They've provided us with gallons of homemade hand sanitizer, which is really difficult to get. I think everyone realizes that. We're all scrambling for that, so I want to thank them for that. I want to touch on a couple other things, and I'm sure some of these will come up in questions later. Steve had talked to me a little bit about the fact that we postponed town meeting. I know Steve consulted with, I'm sure, Melissa, the town manager, Karen Keene, the public health director, and a lot of other department heads, including Superintendent Maestas. And after consulting with all of us, the decision was made to request a postponement to the Attorney General's office for obvious reasons, large gatherings, obviously many more than 10 people, because early on it was 25, and as that changed, we saw the need to do that. So we did write that letter with the assistance of town council, and we did get a postponement. And I think there's a couple dates. I think We were looking at April 4th, and if that didn't work, I think we moved to May 2nd. I don't know, is that correct, Steve, those dates? I'm not 100%.
Yes, they are correct.
Okay, so one other thing I wanted to talk about before we end up with questions at the end, enforcement. I know there's been a lot of questions on enforcement of the governor's rule, the governor's order. I think people have to realize, I know there was one yesterday on the same program. The governor has put out an advisory, which means the governor is advising you to stay home. That's not a mandate. People can move about as long as they're following the rules, hand sanitation, social distancing. You're not violating any rules by actually going out. Now, there is an order, obviously, that to close places that are not deemed essential. So these non-essential locations should be closed. That would be a violation if you open those places. Same thing with the 10-foot distance. That's a DPH guideline. And there's a specific statute that talks about how that's enforced. And what I want to do is I want to tell you a little bit about what the mechanism is and how it would work. But I want to start by saying we don't anticipate doing any of this enforcement because we know that in Plymouth, we're all going to work together to get through this. And that means following the rules of the DPH guidelines that we'll put up. But just so people have an answer to the question, there is a mechanism in place. There's a specific statute, without getting too deep into it, that outlines the guidelines once the governor makes those declarations. So the Department of Public Health, state or local, are the enforcing agent. Now that enforcement agent can be assisted by state and local police, state and municipal police. So obviously we would be doing it under the assistance piece with DPH. So the Department of Public Health puts out the guidelines, they're there to be followed. What we would do is if we see someone that's violating that, we would give them a warning and we would, I'm sure, just talk to them about, being a little more cautious and doing the right thing. But there is a mechanism for a $300 fine. It's a civil violation. It's actually a municipal bylaw. And the way the statute points to that on how that works is a regular municipal bylaw violation in any community under Chapter 40, Section 21H, I believe. Chapter 40, Section 21D. And under that, we would write, if we had to, a $300 fine. And then if it continued with the same person that just continually would not follow the order and we felt it was a health issue, once again, I want to highlight, we don't anticipate getting to any of this as far as violations go. I just want people to know there's a question out there how it does work. We would be able to write that citation. If a person continued, it could end up being a criminal complaint application. Like I say, not something we anticipate getting involved in, but that's the mechanism, that's what's in place as far as following the rules of both DPH and the governor's order. I just want to highlight one other thing. For essential personnel, not just public safety, not just EMS, but essential personnel, obviously one of the issues that's come up is childcare during the day while people are working. And I know that's become an issue with police and fire departments and EMS throughout the Commonwealth, but the governor has designated several, I think a few dozen at least, locations where they will be opening daycare centers for these emergency personnel people only. Now in Plymouth, we have two of them. One of them is the YMCA in South Plymouth, and the other location is the Ponds Child Care Center in the Ponds of Plymouth. So those two locations for essential workers, you need some babysitting to assist you in being able to get into work to continue with your function. I would encourage you to reach out to them. It's a simple simple form to fill out. And I think that as long as you qualify, you're able to utilize that facility. So those are the things I wanted to highlight, and I'll be on the show if there's any other questions. Thanks, Steve.
Thank you, Chief Botieri. One quick question for clarification. You certainly referred to the 6-foot distancing, physical distance, social distance, and you referred to 10. Were you referring to gatherings of 10 people?
Yeah, I'm sorry if it wasn't clear. Yeah, absolutely. I'm referring to any gathering of over 10 people. So technically that's a DPH guideline. So if we go to a house party and there's 20 or 30 people, we're going to warn them and tell them that really they're not following the guidelines and the rules. But I don't see us enforcing. We're not looking to enforce. I would be shocked if we ever got to that point. And that's my reason for explaining it is just that it's come up as a question. And I think maybe a couple times in the last few days on your show, Steve, I've watched some of them and I've heard that the questions come up. So, right, I'm referring to 10 people in a gathering.
Thank you. And that's Plymouth Police Chief Michael Botieri. Michael will continue with us and he'll be available for your question and answers, which you can send to us at plymouth.info@pactv.org. Every day we have a representative who can speak also to the local economy and the business community. And today, once again, we're joined by Amy Naples. She is the Executive Director for the Plymouth Area Chamber of Commerce. Welcome, Amy.
Hi, Steve. Thanks for having me again today. Of course, I just want to say thank you to everyone who is out supporting our local businesses by takeout and online shopping and scheduling your landscaping, painting, and whatever needs. So let's continue those efforts by supporting our small businesses because they certainly do need our help more than ever now than before. We have been quite busy assisting businesses from transferring from working in the office to working at home. I'm sending out an email today for tips and ideas. So you can sign up for our emails through the chamber website, plymouthchamber.com. This will give you technology information, how you can Zoom, just ways that you can work from home remotely and continue to run your business. So also with the governor's advisory, we've received a lot of businesses reaching out to see if they qualify as an essential business. You can find that listing on mass.gov or certainly reach out to myself. We can assist with that. A couple of other updates for the business community I want to mention was the Department of Public Utilities has granted the request to prohibit utility companies from shutting off gas, electric, or water utility services to any customer for failure to pay. The Department of Public Utilities had originally waived this for residential customers, but the amended order will extend to industrial, commercial, and small business customers. So this will help protect residents and businesses alike from the economic pressure, certainly during these times. Another item I want to mention, our friends at Gannett, which publishes the Old Colony Memorial, have created a customer assistance to assist small businesses. This is really to assist with getting their messaging out. It includes free video consultation and free multimedia advertising packages. I can certainly give you more information. You can visit our website, plymouthchamber.com, or our Facebook page for more info. But if any business is interested in participating in that and taking advantage of that free opportunity, I suggest they do so. Another note for the restaurant industry, established license to sell alcohol for on-premise consumption can also sell wine and beer by takeout and delivery, provided that the wine or beer is sold in its original sealed container and is sold in the same transaction as a purchase of food and is not over the volume limitation. So what does that mean for us consumers? We can purchase beer and wine with our takeout delivery. Some chamber updates. We are hosting a webinar Friday at 10 a.m. The topic includes tips, guidance, and tax credits. Our host will be Aaron Andrews of Stratline, which is a great opportunity to hop on there. We will have virtual networking next Monday at 10 a.m. as well. All businesses are encouraged to participate and network with us. In addition, we will be hosting those networking opportunities next week throughout the week. We are also doing a member roll call to touch base with businesses in the community. Let them know what services are being offered via Facebook. All those businesses will be on, all those businesses can let us know what they're doing and their services they're providing. And lastly, each week I want to encourage, or each show, I want to encourage our viewers to support our community businesses. Today, I want to do a push for our local nonprofits. All nonprofits rely on contributions to support their missions, and they are suffering from the revenue losses, whether it's ticket sales or canceled events, corporate giving. I encourage you as a community to support our nonprofits however you can, financially or with your time. It's important for us to have a strong nonprofit sector. It's a vital part of the fabric of our community and making Plymouth a desirable place to live, work, learn, and play. So that would be a tremendous help to those organizations. And we will be launching some initiatives supporting our local nonprofits in the coming days. Certainly, as always, if you're a business that needs assistance, feel free to reach out to myself via email, amy@plymouthchamber.com, or certainly call our office at 508-830-1620. We are in this together and we are happy to support you.
Thank you. That was Amy Naples. She's the Executive Director for the Plymouth Area Chamber of Commerce. You can send her and our other guests your questions by emailing to PACTV information Plymouth information, I'm sorry. Plymouth info at pactv.org. We're just checking to make sure you're paying attention. Plymouth info at pactv.org. I'm so busy looking at Matt Muratore. He is our Plymouth State Representative, and he's going to be joining us now with the state update. Welcome, Matt.
Thanks, Steve. I'm surprised you're not saying that in your sleep now. Plymouth info at pactv.org.
You got it right.
Okay, so here is a update from the state perspective. First of all, the governor will be on at 3:30 today for his daily press conference, if people want to tune into that. As of yesterday, there were 13,749 tests conducted in the Commonwealth. And those are now being done not just by the state lab, by 12 private labs as well. So they are getting quite a few done on a daily basis. Out of those tests, those 13,000 plus tests, 1,159 cases in the Commonwealth, with 9 being right here in Plymouth. And unfortunately, we've had 11 deaths from that as well, all over the age of 50, mostly between 60 and 90, and all with underlying health issues. Just a couple of reminders that, as the chief said, we are under a stay-at-home advisory, but we are under an order for non-essential personnel to close their physical workplace facilities and work from home and remotely as much as possible. That's still in effect. As a reminder, anybody 70 years or older should remain within their home. And we should be able to, as neighbors, help check on those folks. And if we can help them go to the grocery stores or the pharmacy with them, we should continue to reach out and do that. The additional updates that came yesterday, there were 89 deliveries of strategic national stockpile items for healthcare facilities across the state. So we are now starting to see a lot of masks and other personal protection equipment coming. There were over 750,000 masks, face shields, gowns, and gloves that were received today, with hundreds of thousands more on their way. Yesterday we talked about you can now get text by going to COVID-MA to 888-777. So if you want alerts by text, again, COVID-MA, COVID-IDMA to 888-777. So be sure that you do that. I do want to clarify some legislation that has been filed. And Amy, I do want to correct one thing you brought up. Some legislation that was filed yesterday, and we have a committee conference call tomorrow at 2 p.m. to go over this, to recommend it to the entire legislative body. One of them has to do with the permitting of establishments to sell alcohol for takeout and delivery. That has not been approved yet. I suspect it will be, but that's not approved yet. So we don't want people the next couple of days doing that until the bill goes through. So I just want to clarify that. Some other pieces of that legislation is looking to suspend the cap of retired employees, public employees who are collecting a pension, to allow them to work in this emergency situation. So we're looking to do that. There's a number of modified local permitting items that we're looking at around taxes and around permits, whether they're approved or denied, et cetera, or if they have to apply for new ones. So we'll have some more information on that. In addition, the MCAS requirements, we're looking to modify or waive the MCAS requirements for school children as well. The I want to touch upon the daycare situation a little bit more, what the chief said. As of yesterday, there are now 456 centers that are open to emergency childcare for essential personnel. As of yesterday, there were 1,525 children taking advantage of this. With today, they're expected to be over 1,700. So I was glad to hear the chief say in Plymouth, the two that are open, they are drop-in centers. So whether they open at 6:30, 7 o'clock in the morning, whatever, usually they're around that time when they open, and they close around 6:30 at night. What you want to do is just go there. There's a little bit of paperwork that needs to be filled out. And then you leave and you come back and pick up your child at the end of the day. So they are drop-in centers, and they are at no cost to anybody who qualifies under the essential order proposed by the governor. It goes beyond healthcare providers. It goes beyond first responders. It's anybody that still needs to work and be open for the economy, whether it's grocery stores or banks or whatever else. But if you can get childcare through another means, please continue to do that so that we don't overwhelm centers. But they are available and up and running and working fine at this point. Mass DOT has issued just some updates on some items that I just got in. And you can go to the RMV website to see that, but there are a lot of things you can actually do online through the RMV now that they're requesting people to do, so as not to overwhelm the 8 centers that are open throughout the Commonwealth. One of the items they're doing is they're going to be suspending the new Real ID that was due October 1st. That was a federal requirement that was going to take place in October of this year. That will actually be suspended until an indefinite time. So people do not need to worry about getting their license and getting the Real ID at this point. And finally, I want to reiterate the need for, as a healthcare provider as well, the need for blood. There is such a tremendous need. I went to the Red Cross Center in Rainham yesterday, gave platelets, and there are nurses there ready and able to go. They're open 7 days a week. If you are looking to do a blood drive in the area, please feel free to reach out to them. They do have staff ready to do that, but the blood drive is at a severe shortage, more than it ever has been. So whatever we can do to help them out, that would be great. And finally, I wore my Titleist hat today for all the golfers out there. As Ken mentioned, we're reminding that golfers can't golf now, even though the weather is good, but we will be out there golfing shortly. So just be patient out there and just do some chipping in your backyard for now, but stay off the golf course.
And thank you. That is Representative Matthew Muratore. You can send him your questions as well as to the other participants today. PlymouthInfo@PACTV.org is the address where you would send your questions. I want to just highlight the fact that every day, Monday through Saturday, we'll be here, and we have a number of very helpful guests coming up. They include tomorrow, Dr. Gary Maestas, the superintendent of schools, also be joined once again by Karen Keene. She is the Plymouth Director of Public Health. On Friday, we have Roxanne Whitbeck. She is the local veterans agent for the town of Plymouth. Also, Rabbi Lawrence Silverman, and will be joined by another member from the Board of Health on Saturday, and also a representative from the Skilled Nursing Home on Friday. On Saturday, we'll have Father John Cullity, as well as a member of the Board of Health. So we have a lot of guests who are coming who can speak with authority and give you verified information, such as the people here today. We're going to, while we're waiting to see if we have any questions today, we're going to go back through our group of participants in order and hear once again from them as to anything else they would like to say in closing and leaving you with their message today. We're going to begin with Dr. Kenneth Terkelson. He is from the Plymouth Board of Health. Welcome.
Thank you very much, Steve. The one other thing that I would want to underscore is something which I presented at the Board of Health this morning, having to do with the possibility of aerobic transmission. In other words, airborne transmission of this virus. And I will be talking to Dave Kindy at 2 o'clock this afternoon with a view towards getting something out into the paper soon on this. The reason I mention this is because our general advice has been that people are picking this virus up as a result of coughing of large droplets or picking up off of surfaces. But in addition to that, there is evidence that's in the medical literature that the SARS epidemic back in 2003, there were clearly documented instances of airborne transmission in large apartment building in Hong Kong. There was a plane that flew from Hong Kong to Beijing in 2003. 22 people got sick after being on that one plane. All of them got sick at the same time, and it suggested again that this was airborne transmission. It's one of the reasons why it's so important to keep that 6 feet of distance, because the risk of airborne transmission from one person to another goes off very, very sharply after you're at least 6 feet away. So I wanted to emphasize that, and we'll have something, I hope, in the paper that will go into some greater detail on that as well. Thank you very much.
Thank you. That's Dr. Kenneth Terkelson. He is a member of the Plymouth Board of Health. We're going to go back to our police chief, Michael Botieri, for your thoughts that you'd like to leave with our viewers. Chief
Sure,
Botieri.
Steve. I just want to mention a couple of things that I neglected to talk about. The station, the records department, while it's closed to the public, we're still able to process public record requests. That's happening. We have it staffed with the supervisor. And license to carry firearms, we get a lot of questions about that. The law allows renewals to be done through the mail, so we've been doing that. And because of the emergency, they've allowed us to process first-time licenses to carry applications for the license to carry or FID through the mail, and then we'll finish the process at a later time. So I just want to get that out there. We're continuing with that process. I know that a lot of people are asking questions about it. I just want to reiterate, please don't hesitate to call 911 if you have an emergency. We will be responding immediately to that. That has not changed. It never will. And then I'll just end with, please follow the guidelines, the DPH guidelines and the governor's advisory, please. I appreciate it. Thanks,
Thank you.
Steve.
That is Police Chief Michael Botieri. We just had a question come in. We're going to jump for a moment to Representative Matthew Muratore for that question. And the viewer who contacted us was a little confused, wanted clarification when you mentioned 9 people had been tested. I want to clarify whether that's Plymouth or Plymouth County. Did they test positive? Were they hospitalized?
I don't know the particulars. There are 9 people who tested positive in the town of Plymouth.
Thank you. And now we're going to move to, again, to Amy Naples. She's the Executive Director, Plymouth Area Chamber of Commerce. Amy, your final thoughts.
Sure. Of course, just many thanks to everyone who's stepping up to support our community, support our small businesses. It really takes everyone to step up to work together and get through this together. We're going to be stronger. And the chamber is here to support you, support any business. We're all in this together. It's important for us to work together, and it's, of course, support our small business.
Thank you. That's Amy Naples. She's the Executive Director for the Plymouth Area Chamber of Commerce. For those of you who are watching, one of the things that we strive to do is to get you answers to your questions. That viewer question earlier from Jack is a question that we will research, and we'll have the answer tomorrow on our daily broadcast. We're going to continue now with Representative Matthew Muratore for your final thoughts.
Yeah, thanks, Steve. And thank you again for what you're doing in PACTV and all the guests we've had on. And we're fortunate, as the chief said, to be in such a great community that people are working together, and we will get through this, as Amy said, and we will be much stronger as a community and as a nation, I believe, when this is all over. Just again, a few reminders that avoid unnecessary travel and other unnecessary activities. Protect yourself by following the public health advice, keeping your hands clean, covering coughs and sneezes, stay home if you're sick. If you need to talk to your doctor, call your doctor. They do have telehealth, so you don't have to go into the office. You don't have to go into the hospital. They can treat you over the phone. Just a reminder too, that if you want more information, if the texting doesn't work for you, you can also go to mass.gov/COVID-19 to get the most up-to-date information. And you can also call 211 that provides you the most up-to-date information as well.
Again, that is Representative Matthew Muratore. He'll be joining us again tomorrow, along with Dr. Gary Maestas, Superintendent of Schools, Karen Keene, the Director of Plymouth Department of Health, and also Stephen Cole. He is the Executive Director for the Plymouth Regional Economic Development Foundation. And we'll all be joined by Ken Tavares, who is the Chair of the Plymouth Board of Selectmen. And for closing thoughts, Ken.
Thank you, Steve. I would just like to say that I represent the board, but I want you to know the other 4 members are extremely busy in the background. We've all taken up certain projects to assist the town manager and the assistant town manager. Both Melissa and Marlene act as the conduits for the questions that are coming in. I'm pleased to be able to have the contact that I do with the board at the end of the day. I call each one of them individually to have a discussion to see if there's anything on their mind that we need to push up on our to-do list. But I am very proud of the way everyone in the town is working together. It's making our tasks, doesn't make it easier, but it's comforting to know that everyone's pulling part of their load. Also, I want to reiterate what a couple of the past speakers have mentioned, especially Dr. Ken. I did see his presentation today at the Board of Health. It is so important to keep that distance. I know we sound like a broken record, but until the day we can call off the state of emergency, I think we have to continue to say it. We must keep reminding our family members and people that we come in contact with that these rules are for us and to protect us. Thank you, Steve.
Thank you. That is Selectman Chair Kenneth Tavares. Again, your questions, which we'll try to answer tomorrow, email plymouthinfo@pactv.org. This is coming to you live March 25th, 2020. It is the Plymouth COVID-19 update. Today we've been joined by our special guest, Dr. Kenneth Terkelson. He's a member of the Board of Health. Also, Plymouth Police Chief Michael Botieri, Amy Naples. She is the Executive Director of Plymouth Area Chamber of Commerce. Each day we have Representative Matthew Muratore and Kenneth Tavares, Chair of the Board of Selectmen. I'm Steve Triffletti, Plymouth Town Moderator. Thank you and good day.